Teresa here from Life Beyond Diabetes, and I am just getting settled. I'm kind of frantic. I just got back home after seeing patients this morning and then running some errands. So forgive me. Let me just settle in. Take a breath. Tried to get here as close to 3 as I could. Anyway, today we're talking about continuous glucose monitoring. So for those who are not familiar with continuous glucose monitoring, what that is it is a device that is worn by someone that basically continuously monitors your glucose. So instead of poking your finger to get a blood sugar number, it is giving feedback continuously all the time with what is happening with your blood sugar all the time. Now, traditionally, those have been used for people who are taking insulin, and usually insurance in the past has only covered those for people who have type 1 diabetes. I learned on Friday at my conference that insurance is starting to cover them sometimes for people with type 2 diabetes, and sometimes even for people who are not on insulin. It'll be curious to see going forward how that plays out. I think it'll depend a lot on the insurance company, a lot on different diagnoses. But what I want to talk about today is using them as a diagnostic tool and using them to help people understand what's going on with their own specific diabetes and prediabetes. For people who don't have, aren't using insulin and maybe don't even have very severe insulin or very severe diabetes, or maybe not even have diabetes, but have some level of insulin resistance. And I want to use a patient as an example. I'm not going to talk very specifics about this patient, so it's not going to be breaking any privacy rules. But I had a patient that had, when you looked at her labs, everything looked normal. Didn't have any, she didn't look like she had prediabetes. Her A1C, which is a 3-month average of her blood sugar, came back normal. Her fasting blood sugars came back normal. So the basic prediabetes numbers all looked just fine. So that looked fine. Yet she was obese, a BMI around the mid 30s, but she wasn't losing weight like I would expect her to. And so I did, she was eating a really excellent low carb diet. And, with her excellent lab numbers, I didn't really want to give her any of the anti-diabetes medicine because they didn't seem appropriate for her. So I ran a few more labs and I found out that she actually was producing more insulin than I expected. And talking to her a little bit more, I found out that she was having some pretty severe mood swings in the afternoon and getting really tired and sometimes even getting really dizzy in the afternoon. So we talked a little bit and decided to have her start testing her blood sugar at various times throughout the day. And what we found was that she was having some incredibly low hypoglycemic events. So she was having very low blood sugars in the early afternoon. And she was also having mid-morning, so not fasting highs, but she was having some mid-morning really high blood sugars. So these were not showing up in the routine screening labs. But had we put a continuous glucose monitor on her, we would have seen those ups and downs of her blood glucose. I was able to identify that there was an issue probably going on because we saw a high insulin level. So because we saw those things, we changed up a little bit of her diet, took her carbs down lower, started her on some insulin sensitizing medication, and she started losing weight right away. I think that had we not made these changes within a few months or a year, we would have started seeing some definite, notice some changes in her diabetes labs. And I think within a couple of years, her labs would have shown her in full-blown diabetes. So I keep thinking, wow, if we had been able to catch those swings in her blood sugar earlier, what the information that we would have learned from that, and the information that we can learn from getting multiple blood sugar throughout the day, just seeing what's going on all the time with blood sugar for somebody who we're suspecting might have prediabetes without having the labs that show prediabetes. Additionally, when somebody does have prediabetes or early diabetes, using the continuous monitor to show how eating various things affects the blood sugar almost immediately. So for instance, I wear a continuous monitor because I'm on insulin. And when I eat something that has an effect on my blood sugar, I see it immediately. And that it has a big rise. And I learn so quickly how food affects my blood sugar. I've learned how stress affects my blood sugar. I've learned how sleep and exercise affect my blood sugar. So it has significantly helped me improve my health habits because I see what it does to my blood sugar, and I know what that is doing for my long-term health. So I'm really excited about continuous glucose monitor. I'm excited about bringing it to more of my patients as a tool to help them learn. So after the first of the year, there is a new device that will be coming out. There are devices now that providers can use to allow their patients to test out continuous glucose monitors for diagnostic purposes and for learning purposes for a short period of time without using them long-term. There's a new one that's going to be coming out after the first of the year, a new generation. So I'm going to be holding off and waiting until after that one comes out before I start offering it as a service in my own clinical practice. But I'm really excited to get started with that for my own patients. If you have any questions about continuous glucose monitoring, I am happy to talk about it more in the future. I'll talk about some of my own experiences with it, but please add your questions in the comments. And I will be back here tomorrow at 3 o'clock Pacific, 6 p.m. Eastern. And tomorrow we will be talking about the new American Diabetes Association guidelines around diet and some of the changes that have been made in the last couple months, the dietary guidelines, pretty exciting changes. And I will see you then. Bye.